Donning of PPE for use in the operating room. For the preparation, make sure to eat a proper meal, had adequate hydration, attended to personal needs, and provide a clean surgical scrubs, wear closed and waterproof shoes, remove all personal items such as jewelry or watches. You'll need an alcohol-based hand disinfectant, protective coverall suit, shoe cover, N95 mask, face shield, goggles, surgical hood cap, and 2 pairs of clean gloves. Reminder, the inner non-sterile layer should be donned in the donning area. The outer sterile layer should be donned in the OR room. Next is to perform hand hygiene using an alcohol-based sanitizer, or if sink is available, you may do your hand washing. Wear booties or shoe covers. Perform hand hygiene and dry your hands, maintaining its sterility. Wear inner, non-sterile gloves. Wear protective suit or cover all with arm cuff over the gloves. Properly fit N95 mask and check for leaks. Put on your goggles, wear a surgical cap and overall hood. Put on your face shield over your goggles and mask. Put on your second layer of non-sterile gloves. Ensure that no skin or hair is exposed. Proceed to the surgical scrub area. Perform surgical scrub using alcohol-based sanitizer or sterilium. Proceed to the OR room and wear a sterile OR gown. Put on your sterile outer gloves. Make sure gear is well fitted, complete, and intact. Next is doffing of surgical gown and PPE in the operating room. Check shoe covers for gross contamination. If there is gross contamination, remove shoe covers and dispose. Untie and properly remove outer surgical gown. Pull down at the waist away from the body. Once the gown is off the shoulder, pull the gown one arm at a time from the sleeves. Properly remove outer gown. While removing the gown, Bunch up your gown and gloves in a tight ball and dispose. After disinfecting with alcohol-based solution, exit the operating room. Give the signal to enter the doffing area. Check for signs of gross contamination. Use a disinfectant wipe to remove any gross contamination if there is. Disinfect with an alcohol-based sanitizer. Sit down on a dirty chair and remove booties or shoe covers and dispose. Disinfect with an alcohol-based sanitizer. Remove outer glove and dispose. Check inner gloves for tears. And remove face shield. Again, disinfect with an alcohol-based disinfectant. Remove the hair cup and disinfect with an alcohol-based sanitizer. Properly remove the protective coverall suit. Remove the hood. Unzip the suit. And remove the sleeves by pulling them from outside of the suit. Sit on the clean chair. Remove the lower part one at a time by keeping your legs apart. Roll the suit from inside out to form a ball, and immediately dispose the suit on the designated disposal. Remove the inner glove and dispose. Disinfect your hand with an alcohol-based hand sanitizer and check for tears. Wear a new set of clean gloves. Leave the doffing area and proceed to the decontamination room. Remove goggles and personal eyewear. Disinfect your personal eyewear with disinfectant wipes. Disinfect your hand with alcohol-based hand sanitizer. Carefully remove N95 mask and disinfect your hand with an alcohol-based hand sanitizer. Remove inner gloves. Disinfect your hand one last time with an alcohol-based hand sanitizer. Inspect for rips, tears, and cross-contamination on your clothing if there is any. Immediately report this to the trained officer observer. Decontaminate your shoes with a disinfectant wipe or step on the contaminating mat. And lastly, proceed to the shower room to shower and change to clean clothes or scrub suit.